Let me, this presentation is going to be about, is there any hope in metastatic retinoblastoma in 2021? And I'm going to try to convince you that I think there is. These are the results of the COG, the most recent COG study, where some centers in India also participated, and it's there, hopefully are going to be published this year, where patients with systemic metastatic disease have around 80% survival rate. When they don't survive, it is because of CNS metastasis, and in the late event that you see here is about the second malignancy. But you can say that with intensive treatment, autologous stem cell transplantation, around 80% can be cured, and these are results including centers in middle-income countries as well, not only in the US. However, the picture is dismal when you see the patients that have metastasis to the CNS. Here, what we tried to do in that COG study was, as we do for other CNS tumors, is to increase the intensity of systemic chemotherapy to its highest level. That is giving very high dose of chemotherapy, then go into autologous stem cell transplantation because this chemotherapy is myeloablative, and then sometimes even radiation therapy. But even when we did that, we were only achieving around 15% survival rate. So in 2021, we can say that these patients with stage 4A, those are the ones that have metastatic disease outside the CNS, have around 80% survival rate with high dose therapy. So we are doing quite fine with those cases. There is a lot of hope. We can still improve, but when they relapse in the CNS. When we treat patients with stage 4B, the relapse rate is very high. Their event-free survival and overall survival is no higher than 15% everywhere in the world. And most centers in the world don't have transplant. So we have to find new treatment strategies for these patients. So I go back to what Patty has said about the dissemination of retinoblastoma and take that picture that we published in that paper, in this paper with Brenda Galli a few years ago, where retinoblastoma, as you all know, disseminates through the optic nerve, and that is a major way of dissemination of the optic nerve. Also, these are the results of our study we did of the minimally disseminated disease, sorry, where we found that when CSF dissemination occurs, it occurs isolated to the bone marrow. So it is an event that is highly in one compartment, in the CSF compartment. The systemic compartment is almost always free of disease when this happens. So we did that in animal studies as well. We injected animals with these cells coming from our patients and saw exactly the same dissemination pattern. The tumor first in the eye, then in the optic nerve, then to the brain, without overt metastatic dissemination outside the CNS. So these are the conclusions. The CNS invasion remains uncurable. High-dose systemic chemotherapy did not improve the outcome. Dissemination is mostly through the optic nerve, and systemic dissemination can be cured with systemic chemotherapy. So now we have two critical targets that we are not reaching adequately. These are the optic nerve. As Dr. Abramson showed previously, these are the results that we did in our research. This is in animals. So you can see that if you use systemic chemotherapy compared to intra-arterial chemotherapy, the exposure that the intra-arterial chemotherapy gets to the optic nerve compared to the systemic chemotherapy treatment is around 3,000 times. So whenever you give intra-arterial chemotherapy, the optic nerve gets 3,000 times more levels than what it gets when you give it intravenously. And let me go back to the concept that systemic intensive chemotherapy cures systemically disseminated disease. So the only way we have to treat the optic nerve with higher dose of intensive chemotherapy, it's not systemic chemotherapy, it is intraarterial chemotherapy. And the other target organ is the CSF. It is proven by many pediatric oncology researchers that intrathecal or intraverticular chemotherapy work in not only in retinoblastoma, but in other CNS tumors and in acute leukemia. And there is a paper from the Toronto group more than 10 years ago when they used topotecan for intraventricular injection in a case with disseminated CNS disease, and it was safe and effective. And on the other hand, the drugs that we pediatric oncologists use for leukemia don't work. So don't try methotrexate and cytarabine. They usually don't work for CNS dissemination for retinoblastoma. So with that said, we discuss in Latin America this, what we call the triple therapy, target with this rationale in mind. And so the best way we could find some hope to treat these kids would be to give intra-arterial chemotherapy with systemic dose of chemotherapy. These eyes are not going to be saved, so you can give very high dose of intra-arterial chemotherapy, intravenous chemotherapy to take care of the systemic dissemination, because these patients usually have concomitant systemic dissemination at the beginning, not then at the relapse, and then intrathecal chemotherapy in a combined fashion. So with that, we published a paper a few years ago with a case that did very well with this approach. And now Natalia Grigorowski is going to show you another case she treated with this philosophy, and try to think if this could be probably something that could give us some hope for the treatment of metastatic disease. So thank you for your attention, and thank you again for the invitation to participate in this meeting. So I leave the screen to Natalia.